歡迎大家出席今日嘅簡報會。
Welcome to the press briefing. On stage, we have Dr. Zhang Zhokguan, Head of Communicable Disease Branch, Center for Health Protection, as well as Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Zhang will report the number of cases to us. There were 81 positive cases yesterday. Number 10301 to 14111, 4 imported cases, 77 are local cases. Among the 77 local cases, 9 are with the L452R variant suspected to be Delta mutant strain, and the rest they are suspected Omicron cases. There are still with results pending or when the viral load is too low. And there are 15 cases unlinked yet, and the remaining 65 are linked with other cases, including close contacts of Kwai Chung Estate. Since last night, we've had 0 new cases from new units of Kwai Chung. All cases are either close contacts or identified or confirmed when a quarantine center or in hospitals. Among the linked cases, there are some suspected to have vertical infection or transmission. We went to the relevant premises together with departments for investigation. We went to Yonglai House of Yaolai Estate, flat 26. The upper floors are suspected to have some vertical transmission. All flat 26 above 36 floors have to be evacuated. Yamyu House of Shek Yam East Estate, the lower floors of flat 06 are also suspected to have a vertical transmission. So for all flats of 0706, starting from floor, the 2nd to the 8th floor, they have to be evacuated. And also Tower 2 of Tavili and flat E, and also lighthouses. So flats E and D from 26th to the 32nd floor, they have to be evacuated. In linked courses, in Shanti Methodist Secondary School, some janitor staff seem to have some outbreak. There are 2 confirmed cases and some preliminary positive cases. There are about 12 in their team, and all have to be put under quarantine. There is a new case who've been to Cape Collison Crematorium together with family members on the 23rd or around. The mutant strain is L4521L, expected to be a Delta case, so it may be linked to a previous case because some workers there live in Changpo House were confirmed. And then we have 15 cases yet unlinked. 4 of them are suspected to be Delta cases. They live in a mainland house of Chai Wan 2 Estate, Chi Wan San Heng Long House, Long Shen of Lower Chi Wan Shan Estate or Senior House of Chai Wan Estate. There are 10 suspected to be Omicron cases and 1 with results pending. 2 cases in Tuen Mun, in Hon Tim House of Chi Hong Estate, Lung Mun Road, a new Tuen Mun Center, Block 3 in Yolong. There is a picture now of Shui Pin Wai Estate, Kwai Ching, Kwai Yunalo of Horizon Place, and also Fuyat House of Taiwo Hao Estate, Anti East Pak Chi La House of Bok Hon Estate, a Mason building of Old Taipo Market, and also Tikau Tok Village, a village house in Taipo, and Tokawan Yinon Street, number 18, in Tung Chung, the number 16 Caribbean Coast, the area was subject to a restriction and testing, and all cases were tested negative. There were 976 of them. And also Block B of Choi Hing Yun of Kwun Tong. Among the cases we have today, many of them had family gatherings, cross-family gatherings on the 23rd. Now, the Lunar New Year is just at the corner, so if there are cross-family gatherings, there might be some transmissions. That's all from me. Dr. Ho, please give us an update of the situation at HA. As at 9 a.m., in the past 24 hours, HA reported 112 cases. In the past 24 hours, 23 patients were discharged. So far, 12,753 patients have been discharged. We have 1,002 patients being treated in North Lantau, Hong Kong Infection Control Center, HA's Infection Disease Center, and AWE community treatment facilities, and 12 public hospitals. All are in stable condition. Thank you. Q&A. Please raise your hand and use the microphone we hand over to you, and please identify the organization you represent. Any questions, please? The gentleman. Good afternoon. I'm from Hong Kong 01. I've got a few questions. There's news that the government is considering treatment at home. To what extent will the pandemic be before we introduce this measure? Is it because the capacity of AW is near saturation? And what is the difference between staying home to receive treatment and at AWE? Yesterday, there was a secondary school in Chang Kwan O and also buildings there with cases. I'd like to know whether Chang Kwan O have got signs of an outbreak. Are you worried that it will be another Kwai Chung estate? And how should local residents prevent being infected? The number of admissions has been rising recently, and yesterday the hospital authority reactivated halls 9 and 11 of AW, and together with halls 8 and 10, we have got about 1,000 beds in our community treatment facility. Now, for the public hospitals and also our infection control center, there are 1,200 and 800 beds respectively. We have also got 2,000 or so beds available for isolation. So more stable cases or recovering cases are mainly treated at our community treatment facility. Hopefully, we can then make available beds in our hospitals for receiving more needy patients. We will monitor the situation. If need be, we can further operate more community treatment facilities to receive patients. We understand that there are calls from the community that home quarantine should be adopted. If there is any change in this policy, the HA will provide the necessary collaboration. We have enhanced our capacity for receiving patients, but we also encourage members of the public to be vaccinated, which is after all the best way to prevent an infection. You refer to Zhang Guannou. I think that is because in the Towers Yun Yun Institute School, there are a number of cases, but that is not confined to Zhang Guannou. In other districts, we've also got unlinked cases all over the territory. I mentioned districts where cases have been found. So we have to be vigilant, and we should be tested as early as possible. If you suspect or if you feel unwell, tired, and headache, or you have a sore throat, then you should be tested as soon as possible. If you've been to high-risk places, you should be tested as well. Maintain home hygiene and ensure the U-traps are filled with water, and good ventilation at home are also just as important.
將軍澳今日冇
Junguano, we don't have any untraceable cases, but there are some related cases for sure. Next, please. Lady at the back, please. And now TV. You mentioned on the 23rd there was a family mixing causing some cases. So what sort of cases are they? What sort of gatherings were they? How many people were involved? For untraceable cases, what sort of occupations are involved? A Mason building, what block and what orientation of the blocks are they related to any previous cases? We have seen some cases earlier. 14008, 14014, the classification is still indeterminate. Is it, are they untraceable or are they related? And Feng Yi Street in To Kwa Wan, is it tested, has it been tested to be Omicron or Delta? Thank you. But this is only an observation. Last Saturday, we saw two large gatherings involving family members. There were relatives from different families gathering for a meal, and this is a commonplace in Hong Kong. And each gathering involved about a dozen or so, and there were 10 people who got infected from each group, and this is quite common in previous waves as well. I mean, the holiday is coming up, and I urge people to exercise some caution. Mason building has been such a long time, and I don't think they're related to earlier cases. 14008, this is a linked case. 14014, again, this is a linked case. For untraceable cases today, some of them are housewives, and some of them are working, some are children. The next, please. A gentleman over there, please. Mingpao Daily. Dr. Chuang, 14013, is it a linked case? 14013, we haven't traced many sources. Right, Kwai Chung Estate. Now for Kwai Chung Estate, can you give us a breakdown about the increases and how many cases are there in total? You mentioned some untraceable cases, and this has hit 15, a record high. How do you view the state of the latest situation of 15 cases without any known source of infection? Is it a serious situation? Also, Cape Collison crematorium on 23rd, when did they go there? And when did he go there? Did he wear any mask, and where does he live? There are two airport workers, 13945, 1410013. What is the genome sequencing result? Are they imported cases? You mentioned the 23rd family gatherings. How many cases are there arising from that? And how many families are there, and how many families are involved in that kind of gatherings? Kwai Chung Estate, we don't have any new cases, so it doesn't make sense to count the numbers, because we are talking about a close contact or quarantine lease. Cape Collison, that's a crematorium, and they do perform some rites there. He turned up at about 2 p.m. There are a number of relatives there. We will look at we'll contact trace to identify the close contacts. For the 2 airport workers, the whole genome sequencing has not become available yet. We will try to ascertain whether they are related to any imported cases. The gathering on the 23rd, this is only by way of an example. We've noticed some family mixing there. As to the details, it doesn't really matter at all. Next, please. Untraceable cases, the number is increasing. The total number seems to be below 80 odd, but in fact, we have seen an increase in the number of untraceable cases. It shows that the chains of transmission have become rather blurred. In some districts, in some housing estates, we've picked up some cases. However, we cannot specifically pin down the chain of transmission. There are not close contacts involved in gatherings and meals. In the community out there, there may be some spread out there, and there may be some broken chains of transmission somewhere along the line. And with Omicron and Delta, they are actually spreading in the community. We may be seeing some cases that go seek medical attention or go test it, that we can pick them off. The lady over there.
From SCMP News, few English questions. May I check how many prelim positive cases are here today, and what are the types of cases in the latest prelim positive cases? And my second question is, you've mentioned about the Lunar New Year coming out and exercising caution. Are you worried that there will be an uptick of cases in the near future and that the wave will worsen again? Thank you.
Yeah. Around more than 70 prelim positive cases at this moment. I don't have the details yet. For the coming Lunar New Year, I understand many families would like to gather together and sharing some meals or eating some, enjoy the festival. So I would like to alert that be careful, especially if there are elderlies involved or who has not yet get vaccinated. If they get infected, there may be some complications. Yeah.
下一位
Next, please. Any further questions? Gentleman over there, please. AM 730, you mentioned Caribbean coast. There is an unknown case. The lockdown also happened. The lockdown, you the no case. How did you identify this particular case? And Mason building, there was a vertical transmission before. Is it a repeat of the vertical transmission? Choi Wan Estate, there are 2 untraceable cases there. Are there indications that this is spread to the entire estate, or is it related to Wong Tai Sin district as a whole? Also, you mentioned 3 housing estates. They're suspected to be suffering from vertical transmission, and there was evacuation. Last night, why do you make the announcement only today? It gives people the impression that they are kept in the dark about what's happening. Caribbean coast, the case developed some cough, and he went to the doctor, and we saw a positive case there, and there was a lockdown there. Now, for the vertical transmission, they are preliminary positive cases, and they were picked up after the press conference. We keep receiving cases. If they are linked, if they are related, we will work with other departments to carry out our tasks, and we keep media informed. And these cases have become positive today. Mason building, Choi Wan Estate, they are a little bit scattered, although some have been to the Choi Wan shopping mall. They are living there, their residents there. They would frequent these shopping malls from quite a lot. They didn't turn up at the same restaurant, or they didn't use the same shared facilities in the community. in that area there may be some spread, some transmission of Delta variant. In other cases, there may be some Omicron that is being spread.
Mason Building. I haven't checked the exact flat number, but then it's been quite a while since we had outbreak in other flats, so they may not be linked.
Bill Cox, Epoch Times. Can I ask Dr. Ho for some further information about the patients that you have at the moment, the 1,002? How many of them are vaccinated and how many unvaccinated? In each category of Delta and Omicron, and also what's the severity of the people between vaccinated and unvaccinated? Can you give a description of how they vary? Because you say they're all stable. What's the difference?
So at the moment, in the fifth wave, we have a case have been serious. Now all of them are stable. So we don't have the further breakdown of whether they are vaccinated or unvaccinated at the moment. We are still monitoring of the situation, and then further analysis may be done and presented by experts later on.
Next, please. Yes. This lady in white in the second last row. I'm from Oriental Daily. The number of preliminary positive cases is at 70 odd. All right. Yesterday, we were told that there were 11 cases yet to be traced. Can you tell us their occupations and whereabouts they have been in Hong Kong? And you told us that there was no new flats infected in Kwai Chung Estate. Does that mean that most of the transmission chains have been broken and all contacts have been quarantined? When do you expect there will be no more new cases? As regards Choi Wan and Choi Hong and Wong Tai Sin, there may be the risk of lockdown because there are more cases found there. Today, we understand that a senior customs officer is tested preliminary positive. Can we be given more details? I'd like to know the number of close contacts at work. We do not have a new flat in Kwai Chung Estate with cases. We believe the outbreak is already, the transmission chains have been broken or intercepted. There may be cases in the vicinity, and of course the residents there still have the chance to be infected. As for untraceable cases and where they have been, we have included those places in the compulsory testing notice, and it's hard for me to tell you one by one whether there will be outbreaks or special control measures in other districts. It depends on the situation. I will not further mention individual cases, in particular if they do not involve any outbreak. I will not go into the details of each and every cases. We will take one last question. Good afternoon. There are two Methodist school in Sha Tin. Can you tell us the exact address? You said that many cases have been to the shopping mall of Choi Wan. Have you checked a CCTV record to see whether there was any contact and whether there is any transmission there? Now, will you review the guidelines so that patients can only be discharged if 3 tests of their respiratory tracts in a row is over CT33? You said that there are 2 Methodist schools in Sha Tin. I have to double check. I'm afraid I might get the address wrong. I'm not saying that there is definitely an outbreak at Choi Wan Shopping Mall or Choi Wan Estate. People who have been there should be subject to compulsory testing. But then there are some cases in around Choi Wan, and it's not surprising that some of them might have been to the Choi Wan Shopping Mall. I think the criteria for discharge will follow our understanding of COVID-19. We need further studies by experts, and the Center for Health Protection and the Hospital Authority have to agree on discharge criteria, and we might have to adjust our treatment and conditions for discharge based on studies. One last question from the reporter up there. Good afternoon, I'm from HKT. Of Yau Tong Yale Estate, Shek Yam East Estate, and also Cheng Yi housing estates, there might be the possibility of vertical transmission, and evacuation may have to be done. I'd like to know the number of flats and a number of residents involved that require evacuation. 4 flats in Yau Lai Estate involving 12 residents. Shek Yam East Estate, Yam Yu House, 14 units. $30-odd residents. Tivoli, from from floors 26 to 32. About 12 units, flats D and E. Number of occupants, we're still trying to find out. All right, the PB end here. Thank you very much.